Binge eating disorder. Binge eating disorder is a serious eating disorder in which it is common to consume very large amounts of foods and you feel like you can't stop eating. Almost everyone eats too much from time to time, for example, for a few seconds or on a festive day. But for some people, eating too much gets out of hand, and it often crosses the line for eating disorders. If you have an eating disorder, you may be mistaken for binge eating and vow to stop. But you feel this compulsion, which will not be able to resist its impulse and continue gluttony. If you have an eating disorder, treatment may help. Symptoms: most people with eating disorders are overweight or obese, but it is possible to have a normal weight. Behavioral and emotional symptoms of an eating disorder include eating an unusually large amount of food over a certain period of time, such as for about 2 hours. It feels like the feeding behavior is out of control. It exists even when you are full or hungry. Food fast in episodes is okay. Eat until you feel uncomfortable. Often eaten alone or in secret. Feelings of depression, disgust, shame, guilt, and anger throughout the meal. Often their diet can be complete without losing weight. Conversely, people with bulimia may not need to regularly compensate for the extra calories consumed after a party by vomiting, using laxatives, or exercising excessively. You can try to make a diet or eat regular food. But this is a dietary restriction. It can only lead to even more Instagram. The severity of violations of the order depends on how often the areas in order may occur during the week. When to see a doctor. If signs and symptoms of an eating disorder occur, contact your doctor as soon as possible. Problems due to overeating can be different, of course, short-term, recurring, or they can persist for years if left untreated. Talk to your doctor or mental health professional about your overeating symptoms and feelings. If you don't want to seek treatment, talk to someone you trust about what you're experiencing. A friend, lover, teacher, or religious leader can help you take the first steps to success in treating eating disorders. Using the symptoms of a loved one. For people with eating disorders, you can become an expert at hiding behaviors that make it difficult for others to spot the problem. If you have a loved one you think is having symptoms of an eating disorder, open and sincere discussion of their problems. Ask for encouragement and support. Ask to help a loved one find a qualified health professional or mental health professional and make an appointment. You may even be able to invite them to go with them. Reasons: the causes of eating disorders are still unknown. However, genetics, biological factors, and long-term diets, as well as psychological problems, also increase their risks. Risk factors: eating disorders are more common in women than in men. Although people of any age can have an eating disorder, it often begins in their late teens or early 20s. Factors that may increase the risk of developing an eating disorder include family history. You are much more likely to have an eating disorder if you have parents or siblings who have, or have had, an eating disorder. This may mean that inherited genes increase the risk of developing eating disorders. On a diet. Many people with eating disorders have a history of dieting. Following a diet and limiting calories throughout the day can lead to the urge to overeat, especially if symptoms of depression are present. Mental health issues. Many people with an eating disorder feel positive about themselves and their abilities and achievements. Triggers for order can be stress, poor body image, and the availability of products for order. Complications: it can be noted that the development of mental and physical problems associated with overeating. Complications that can be caused by an eating disorder include the following. For poor quality of life: problems at work, in your personal life, or in social situations. Social isolation. Obesity: diseases associated with obesity, such as joint problems, heart disease, type 2 diabetes, esophageal gastro-reflux disease, GERD, and a whole host of sleep-related respiratory disorders. Mental disorders that are often associated with eating disorders include the following. Depression, bipolar disorder, fear of substance use disorders. Prevention: at the moment, there is no way to prevent eating disorders, and if you experience symptoms of overeating, seek professional help. Your doctor can give you advice on where to get help. If you think that you have a friend or lover, then this is a problem of overeating, just direct him or her in the direction of healthy behavior and professional service will worsen the situation. If you have a child, to enhance and promote the health of the body and image, regardless of body shape or size, I should discuss any doubts with your child's doctor, who will be in the right position to detect early signs of eating disorders and help prevent the development of eating disorders.